Mukuru is an informal settlement nested in the heart of industrial area. Many of residents are casual laborers and others do small businesses, selling fruits or hawking, but a majority are never employed. Some are left with no option but to scavenge for food in the nearby dumping grounds for their livelihood. Earnings are extremely low to feed their families. Consequently, children look for other means for survival: prostitution, begging, criminal activities, and child labor. Surroundings of Mukuru villages comprise of population of more than 600 families who live in corrugated metals, shack measuring 10 by 10. Large families cram into these tiny spaces to survive and are in extreme poverty. The high level of poverty puts the basic education beyond the reach of many families with no public school at all, which has impacted negatively on the overall education levels on the community, contributing to high illiteracy and high levels of dropout among the orphans, youth, and the affected children with HIV/AIDS pandemic. Although the initiation of Mara Children's Center has played a major role in rescuing children who have never been to school to access basic education, there are still poor general living standards in the slum. Children in this environment need to be helped to aspire for high goals in life, especially those drawn from total poor households. Mara Children's Center strengthens the capacity of the underprivileged children to overcome life challenges. Feeding program for the needy, especially 2.5 years, to combat malnutrition. Healthcare services are beyond reach of most Mukuru residents. Malnutrition is visible among the children, mainly related to high cost of food and family income. Hence, many children survive with one meal in a day provided by Mara Children's Center. HIV and AIDS remain the greatest cause of death, making children more vulnerable and leaving them under the care of grandmothers too old to care for them. Others need special attention, for example, those with disability, deaf, cerebral palsy, and the dumb. Though Mara Children's Center is striving to achieve improvement in the quality of life through giving hope, emotional support, food, clothing, education, shelter, and medical care, we still face many challenges. Our children learn in makeshift structure made of wood and corrugated metals. Children may suffer health problems attributed to the cost of the classroom. The classrooms are congested with more than 60 children. We need better infrastructures, for example, toilet, which the center has only one within the school and this community at large. Lack of teaching materials, desk, adequate sanitation, and recreational facilities undermining the psychological, emotional, and physical growth of the children. Many children are walking on barefoot, which exposes them to infections. To accomplish mission, we join ventures with partners, individuals, donors, sponsors, foundations, and friends who can give a comprehensive support in all our programs. We do appeal through the love of God. If your heart is touched, we can be part of this great mission.
Come.